Welcome. Before we get started, if you could introduce yourself by first name, starting with Lauren.
I'm Lauren. I'm Ashley.
John.
Nikki.
I'm Sophia.
Allison. Lexi.
Hey.
Lori.
Thank you. Life is not measured by the number of breaths we take, but the moments that take our breath away. Maya Angelou was quoted recently in the Cystic Fibrosis news today. It is a reminder that CF patients need to stay strong with their battle with simply taking a deep breath that many of us take for granted. It is a basic physiological and voluntary response for survival, but for cystic fibrosis patients, it's a struggle. Because I have an 18-year-old nephew named Reed with this genetic disease, I have learned many components people living with CF go through in their day-to-day life. Reed was diagnosed just shy of his 5th birthday in 2005. He was chronically ill since birth, but they could never pinpoint until he saw a pediatric pulmonologist. Once he was diagnosed, he was transferred up to the Children's Hospital in Atlanta for intense antibiotic treatments for 2 weeks. More than 70,000 people living with cystic fibrosis worldwide, and with more than half of the population over 18. And this is from the Cystic Fibrosis Foundation Patient Registry. First, we will learn what exactly is cystic fibrosis. Then we will learn how patients live with the disease. Lastly, we will learn about the Cystic Fibrosis Foundation and the advocacy for a cure. What is cystic fibrosis? It is a genetic disease that affects a particular protein in the body that helps with mucus. This protein, when working properly, helps move chloride to the cells to thin out mucus, which protects the linings of organs from disease and infection. In CF patients, this protein is faulty, which causes a buildup of mucus, thick and sticky, in the lungs and pancreas. So the lung and pancreas issues. Mucus builds up, which causes infection and inflammatory and breathing issues. It's like breathing through a straw every day, and it's hard to imagine. Pancreas issues. The mucus builds up in the pancreas area, and it halts the release of an enzyme to digest food, which hurts with growth and vitamins, causes vitamin deficiency and malnourishment. Symptoms of cystic fibrosis. Very salty skin, persistent coughing, wheeziness or shortness of breath, poor growth and weight gain, greasy, bulky stools, and male infertility. Not everyone has these symptoms. These are general. Each cystic fibrosis patient is different. Now that we have a better understanding of what cystic fibrosis is, what is it like to live with it? Lung treatments, daily medications, includes airway clearance, inhaled medications, such as sodium chloride, albuterol pulmozyme. Pancreatic treatments consist of pancreatic enzymes, which helps the digestion and absorb nutrients. Next, we have a short video of Reed and I speaking about his nebulizer treatments and vest. Please take a look. Okay, this is Reed Shaw. He's diagnosed with CF when he was right before 5th birthday. And this is his vest treatment. What does the vest treatment do for you?
So like, I take different kind of medications in these tube-like things, and it like comes out in the mist, and then like they have different jobs. It like breaks up the mucus, makes it loose.
So the vest breaks up the mucus by shaking you, right?
Yes, and it makes it easier to like cough it out and get it out of my lungs, make it easier for me to breathe.
And then, so you have to do this vest treatment how many times a day?
I do 2 times a day, morning and night.
And then how many cycles? Do you have to do it 2 different times?
I do
10 minutes?
I do 3 cycles. It takes around 30 minutes, and I have like different kinds of settings for each one. The first one is 10-6. The second one I do 12 and 5, and that's with sodium chloride. And then the third one I do 14 10 and 4, and that's what the poem is on.
Well, thank you, Reed. Next thing we'll talk about is diet. A good diet in CF patients consists of high protein, high fat, and high caloric intake to help malnutrition and vitamin absorption. Hand washing with precautions is to prevent infection and cystic fibrosis. Not share your eating, drinking utensils with others, and they're unable to work in healthcare because of compromised immune systems. They must be careful to be around other cystic fibrosis patients because of possible cross-infection, which Henderson talks about, which is passing infections to one another in their lungs. Lastly, we will learn about the foundation that has been a positive impact in cystic fibrosis patients since 1955. It was created when no treatments were available for patients and their life expectancy was shortly past birth. Cystic Fibrosis Foundation raises money for future advancements with medications and treatments to eventually find a cure. For example, Reed was one of 6 chosen in Georgia for a clinical trial of a medication called Kalydeco, which was successfully approved as another treatment for CF patients. Great Strides is a wonderful way to raise money and awareness for the Cystic Fibrosis Foundation. It's an annual walk and adds tomorrows for CF patients. I've been a part of Great Strides for the past 13 years in some capacity. The ultimate goal of the foundation is to find a cure for the terminal disease. As I have shared with you today, living with cystic fibrosis is a lifelong fight. It is a constant medication treatments, a specific diet, and many precautions to stay healthy. With that being said, it is a fight with Cystic Fibrosis Foundation that wants to win and add tomorrows for their patients. With the advancements of Great Strides, we hope for a cure someday. One day CF will stand for Cure Found.